Chronic fatigue, brain fog, joint pain, mystery symptoms that don't go away? What if the root cause isn't your gut or hormones, but a hidden infection in your jawbone? Today, we're exposing a silent condition most dentists never talk about: dental cavitations, and how they may be fueling systemic illness. Welcome back to the channel, where we connect overlooked symptoms to real root causes. In this episode, you'll learn what dental cavitations actually are, how they're linked to chronic inflammation and illness, the warning signs to watch for how to get diagnosed and treated properly. If you've had wisdom teeth removed, root canals, or jaw trauma, this is a must-watch. Part 1. What is a dental cavitation? A dental cavitation is not a cavity. It's an area of dead or decaying bone, usually in the jaw, left behind after tooth extraction or trauma. Instead of healing properly, the bone becomes hollow and infected, often filled with bacteria, toxins, and necrotic tissue. The result? A chronic, low-grade infection that the body keeps fighting, without obvious dental pain. Part 2. What causes them? The most common culprits: improper tooth extractions, especially wisdom teeth. If the periodontal ligament isn't fully removed, healing stalls. Root canals. While the tooth is dead, it can harbor bacteria that seep into the bone. Jaw trauma or surgery. Physical injury that disrupts blood flow to the bone can create a cavitation site. Poor healing or circulation. Chronic illness, smoking, or nutrient deficiencies may impair proper bone regeneration. Part 3. Systemic symptoms and illness links. Because cavitations are often silent infections, they can trigger chronic inflammation throughout the body. Symptoms may include fatigue or brain fog, joint or muscle pain, neuralgia, nerve pain, autoimmune flares, unexplained anxiety or depression, persistent sinus issues or ear pressure. They've even been linked to heart disease, breast cancer, and Lyme disease complications in some holistic research circles. Part 4. How to get diagnosed. Cavitations rarely show up on regular dental X-rays. Instead, look for 3D cone beam CT scans, reveal bone density loss or hollow pockets, thermography or EAV testing, used by biological dentists, pain upon pressure near extraction sites, even years later. A functional or biological dentist is your best bet for proper diagnosis. Part 5. Treatment and recovery. If a cavitation is confirmed, surgical cleaning, curettage. The infected bone is cleaned out, often under sedation. Ozone therapy kills bacteria and promotes healing. PRF, platelet-rich fibrin, uses your own blood to speed bone and tissue repair. Post-op support, nutritional support for immune healing, vitamin D, K2, C, CoQ10. Most people report a dramatic improvement in systemic symptoms once cavitations are addressed. Cavitations are real, and they're underdiagnosed. If you've had extractions or root canals and you're battling unexplained chronic symptoms, don't overlook your jawbone. Your mouth might just be the missing link. Like, subscribe, and check out our next video on how oral infections impact your heart, brain, and hormones. Because true healing starts when we look beyond the obvious.